So I've got a list of questions for you here, Bill, but first I want to say thanks so much. As I was mentioning earlier, that innovation doesn't happen without investment. And being the market leader, I think Allergan's active involvement in this industry, not just from an innovation standpoint, but from embracing emerging technologies, I think has really been powerful and an important piece of this. So I'd like to start off first with maybe give us, before we get into Allergan, a little more background on you, sort of how you got to where you are, and share with us some of that.
I'm not sure people are that interested. Well, way back when, I played minor league baseball for several years, and I figured out I couldn't hit. Then I joined public accounting. I figured out I couldn't count. And then I joined a New York-based pharmaceutical company called Forest Laboratories, held positions in sales, marketing, and business development over many years. And then with the merger with Allergan, and I guess it was 2015 now, so almost 5 years, I took over responsibility for the commercial operation.
Fantastic. Well, it sounds like my background. I mean, I wanted to be a doctor. I wasn't smart enough, so I went into medical devices. So let's start with Allergan. I mean, it's a big, diversified company. Where does medical aesthetics fit into the overall part of Allergan, and how do you think about that in terms of the priority to the company when you allocate resources and going forward?
Yeah, it's a good question. Look, it's the flagship product line. It's 40 to 50% of sales. It's split between the U.S. and the international business. It's the most innovative, the most durable, and the most profitable. And it gets a great deal of attention by many people inside the company.
Okay. There's a lot of discussion when we look at the aesthetic market that we're still in the early innings, and that penetration still is low. People talk about, hey, maybe we're 10% penetrated in the market. So share with us a little bit your view on where we are in sort of the penetration of the market, what efforts Allergan is undertaking to try and help and grow that, and whether or not there's any sort of macro trends that are emerging that you think are noteworthy.
Yeah, I think those numbers are right. Based on our research and analysis, in 2018, we estimated roughly, let's call it 4.5 to 5 million people received a facial injectable. We estimate that there's somewhere in the range of 60 to 70 million people who could be sitting on the sidelines who are interested, which means you're actually under a 10% penetration rate. And as you mentioned, I think there are three things that will drive the growth in the market, and I do believe it has the potential to double between now and 2025. The first one is attitudes and perceptions towards aesthetics are evolving. It used to be that people wanted you to notice but not know, and I think that's changing. And like you said, it's being thought about as part of diet and exercise. That's number one. Number two is there is a millennial movement, which we all talk about. Gen Xers are still the biggest consumers of aesthetics and will be for several years, but by 2025, I think it will be the millennials, and they are unapologetic about aesthetics. Prevention is on their mind. They do their research, and while they'll never be as rich as their parents or their grandparents, they spend more of their disposable income on aesthetics. And then as it relates to digital advertising, listen, both for manufacturers and for practices, it's just a great enabler. I found out from Google Trends there are 50 million people searching for information about aesthetics online each month. And so I think the more access people have to aesthetics, the more likely that they are to receive a treatment. We have done a great deal in terms of when we think about the role that we play in the market. The first is to develop new products and technologies, because this category, if you really think about it, was built on new products and technologies that enable plastic surgeons and dermatologists and other providers to deliver great aesthetic outcome. That's number one. Number two is training, and we try to have the most expansive and most sophisticated training program in the industry. And then number three is consumer education. And all the companies are doing some level of DTC advertising, whether it's television or digital, and trying to enable practices to do the same. We launched 2 digital ventures that are unbranded. It's not about Botox and Juvederm. One is called Spotlight, which is an online destination for all things beauty. So think about the top of the funnel for the first time considerer of aesthetics. We had about almost 2 million visitors to the website, I think, by the end of the year. And then we launched another digital venture called Reggie, which is simply open table. Think about purchasing an aesthetic product or service through an open table type app. And again, this is not Botox or Juvederm or Cool Sculpting specific. These are unbranded. And the last point I'd make is, and HintMD I think is probably in the room, I think what Aubrey Rankin is doing with a payment processing technology and a subscription service potentially is awesome. You know, we talk about millennials. The average millennial has 6 different subscription plans or memberships. And it's puzzling to me that the subscription economy has not migrated more into aesthetics than it has. And we have an investment in HintMD, but it's not an Allergan program. We just would like to see that company be successful. It won't apply to every practice, but it will apply to some, and I think it's a great way to, again, enable more access.
Great, thanks for sharing all those. Again, as I mentioned earlier, I think that there's a lot of exciting things that are happening, and listening to you, I think that there's a lot of reason for optimism in terms of some of the new technologies coming forward. Let's shift now to talk about, you know, sort of how you think about, as the market leader, protecting share versus growing the market. And in particular, there's obviously a lot that's happening in the toxin side of the business with competition coming in. So help frame for us how you think about that market, how you allocate capital, and maybe a little bit more about the toxin market in particular.
Yeah, I try not to think about aesthetics as a market share battle between companies. Sometimes it's hard to avoid the conversation. It gets asked a great deal. The market is on a solid growth trajectory. It's not a zero-sum game. No market should be served by one product. Aesthetics has never been a one-product market. It never will be. Our focus, the only thing that we can control, and I think most companies can control, is the new products you bring to market, the training support you provide, plastic surgeons, dermatologists, and others, and consumer education. That's what you can control, and that's what's relevant. And I think competing on those vectors is going to result in a healthy future for the industry. I think competing on price is a slippery slope. It's Pandora's box. Ultimately, price discounting, you know, cuts into profits, cuts into customer service, cuts into R&D, and lessens the perceived value of a product. If the market wasn't growing at the rate it's growing, and if it didn't have the potential to continue to grow, I'd probably focus a little bit more on market share. But right now, what we try to focus on is our customers and helping them attract more users into the category. Because, listen, we're all part of companies here. We don't grow this market. The plastic surgeons and the derms grow it, and they grow it by delivering great outcomes. You know, what drives someone into aesthetics is overcoming the fear of an unnatural look. It's getting as much information as they can to answer any questions, and it's talking to a friend or family member. That's what drives someone in. And if aesthetic providers are delivering a great service because of the products that they get and the support that we provide them, this category will be successful, and there'll be room enough for all the companies that are doing work here. I think at the end of the day, it's an efficient market. It's not going to support too many more products, but I'm not worried or focused on market share swaps between companies.
Makes sense. You know, you talked a little bit about kind of the plastics and the derms, which obviously are the cornerstone of the market, but there's no doubt that if you look at the number of consumers that are likely going to enter into this market and the growth that's expected, we're also seeing a pretty significant growth in terms of the number of providers on the non-core side. Part of that's being driven by, you know, there's more patients. Some of it's being driven by some providers like GYNs wanting to get exposure and access to the cash pay market. You know, how does Allergan think about supporting both the core and the non-core, and how do you see the growth of the non-core market impacting patient experience, results, and what you do to contribute or to, you know, ensure good outcomes there?
Yeah, it's a really good question. I was just talking to Grant Stevens a little bit about it. It's tricky for companies, and I think most people in this room will recognize that, to pick and choose who you do business with. It really is. What we try to focus on are practices that have a serious long-term commitment to aesthetics. That's where all of our time, all of our energy and all of our money is focused. And that starts with plastic surgeons and dermatologists. I think long-term, providers who are attempting to dabble in aesthetics, which is a mistake, won't be around very, very long. And I think all we can do is focus on serious customers. That doesn't mean non-cores aren't buying our products, but over the long term, I think our orientation is the right one. Yeah.
You know, if you look at the consumer, you talked about some of the millennials spending more of their kind of discretionary income on aesthetic procedures. So maybe talk a little bit about how in today's healthcare environment where people are having to come out of pocket more for healthcare, kind of where you see aesthetics fitting into those decisions. And then also, you know, how important is the economy such that if, you know, we benefited from a pretty healthy economy, if we were to see a downturn, what sort of impact would you expect that to have on our industry?
Look, if you go back to 2008, which I think is described as the Great Recession, not the Great Depression, but the Great Recession, I don't think we'll see, I'm looking at David Anselman right here, I don't think we'll ever see a year like that again. Would you agree? Probably not. So during the Great Recession of 2008, I'm sure if you asked Jamie Dimon, he would say it would never happen again. The sales for Botox at Allergan traded in the low single digits. And so what I would say about aesthetics and its exposure to the economy is that it's a fairly durable, resilient business. That's not to say it's not a risk, but it's a fairly resilient, durable business. I think what we should recognize, there's only two things that can hurt aesthetics because it's soaring in popularity everywhere you go. Here, San Francisco, Shanghai, Dubai, London, Sao Paulo, you name it, just go around the world. There's only two things, in my view. The first is a safety problem of any kind, and it can come from any direction. And so we should all realize that all the products that we market and we provide to consumers have benefits and risks. And I think the benefits far outweigh the risks. But it's important that, and we respect and appreciate just what plastic surgeons and dermatologists and others are doing. And then the second thing is price erosion. Those are the two things. If we focus on R&D and training and customer service, even through a tough economy, this business has a great outlook. And I've worked in probably 10 different sectors of healthcare, psychiatry and gastroenterology and neurology and infectious disease. You mentioned OBGYN. There's nothing like aesthetics. It by far is the healthiest, most innovative sector of healthcare, and the relationships that the companies we have with plastic surgeons is awesome. I mean, it is great. I love going to aesthetics meetings. I don't mind going to the other meetings, but I love going to aesthetics meetings, and so that's how I think about it.
Can you touch a little bit on, you know, this percentage of spend when people think about allocating dollars? Do you have any data in terms of kind of, because, you know, sometimes you'll see market research that says, well, certain people can't afford these procedures, right? And so when you look at millennials spending a greater portion of their income on things like this, you know, how do you think about people's ability to afford these treatments and whether or not that factors into aesthetic decisions even in today's economy?
Look, I think aesthetics is a great bargain. I don't know why there'd be any focus on price. I mean, if you think about how good it makes someone feel when they walk out of a plastic surgeon's office with an excellent outcome, and if you think about the cost of most procedures on a daily basis, with the exception of certain surgeries that last forever, I don't know, it's probably not much more than a Starbucks coffee. And so I know there's people in this room that know this number. I'm not sure it's right, but I think people spend about $2,000 or $3,000 a year on skincare. Is that right?
Sounds about right.
And so let's say someone's disposable income is, I don't know, anywhere from $50,000 to $100,000 on average. I don't think disposable income is going to be a deterrent for someone entering the aesthetics market. The reason why we've only penetrated 10% of the market has absolutely nothing to do with economics, absolutely nothing to do with cost. Anyone who thinks it does is wrong. And that's why I don't think price should be the focus of aesthetics. People generally sit on the sidelines, and we did the largest research survey with consumers, I think ever. I think there were 14,000 people in it. And it's fear of an unnatural look, it's lack of information, and not being able to find a high quality provider, believe it or not, which isn't a surprise. What people do is they go on Google and they type in a name and they get a listing and they're like, maybe I should talk to a friend or family member and hope I get it right. And they still don't get it right. And so the more information we provide people so that they understand the benefits and risks of aesthetic treatments, and their benefits are awesome, the risks are low, and the more we can enable access so that they can get to the right office and right practitioner, the better this market's going to be. That's where the focus ought to be. Yeah.
Makes a lot of sense.
Yeah.
Bill, you talked about, sort of allocating R&D dollars and investing in innovation. How does Allergan think about internally developed programs and investing in innovation on that side of it versus M&A? And do we expect to see Allergan still active on the M&A side? So how do you think about that?
Yeah, we strike a balance between internal development, product development, and business development. Some companies are pure discovery shops. We think that we know that there are literally hundreds, maybe of thousands of small companies around the world. There are many in this room that are doing great research. And small companies have proven that they can do research and development as good as large companies, maybe better. And early stage development can be risky, time consuming, and costly. And we like balancing internal development with business development. There's definitely not a shortage of new product opportunities in aesthetics. And we like to consider ourselves a very good buyer in terms of the price we pay. We don't look for a bargain. In terms of our flexibility in making a deal, we did a deal with you. And in terms of the speed with which we do deals. Because there's only one thing that really kills a deal. It's time, as you know. And so we'll continue to balance the work that our researchers internally are doing on toxins and fillers, and of course on cool sculpting, as well as implants and our regenerative medicine area and skin medica. I don't want to miss anything. With talking to small companies who have great technologies that we want to work with. And recently we purchased Envy or Dermal Infusion, which we see as a gateway for millennials. Skin care and skin quality is an awesome market, which we've sort of just started to scratch the surface of, so to speak. We acquired Bonti, which is a rapid-acting, short-duration toxin. And we acquired Elastogen, which would allow us to evolve our filler line. And so you'll see us active on the M&A front over the next several years for sure.
Great. Maybe talk a little bit about, from your perspective, what are some of the big unmet needs? So obviously there's some great innovative technologies that are already kind of working their way through the system that are targeting different areas, but are there any sort of areas in particular that you can share with us that you sort of look at as saying, hey, if we could do a better job in this area, that would certainly help unlock a market or really, cater to some of the consumer needs that aren't met today?
Yeah. There's some experts in the room. I see Grant over there, and I saw Steve Diane and Doug Steinbreck, and they probably are better to answer that. But what we like, I think the entire area of skin quality has enormous potential. Not an easy puzzle to solve, but products for skin quality, I would say skin tightening, cellulite is another important area. Third would be hair growth. If anyone can solve that, that'll...
I see you looking at me on that one.
No, you look good. You're doing fine. We have a couple research collaborations in place with UCLA. There's also, we have a regenerative medicine unit when we acquired LifeCell. I think Rich Egan may be here in the room, which is a great business. Those would be the four areas that we're focused on. And this stuff takes time. I mean, you got to be willing to take some risk. You're going to fail. But over the long term, The aesthetics market will continue to evolve in a positive way for all of us if we deliver products to plastic surgeons and others that improve outcomes. Because the better the outcomes, word of mouth travels fast. And, you know, we talk a lot about what we do as companies. I mentioned earlier, this market is piping hot right now because of the providers. Because people walk into a practice, high quality practice, and they love the experience, and they have a great outcome. And the only role that we play in that is introducing new products that help providers do their job. And those areas, if we crack the code in those areas, you'll see another wave of massive expansion in aesthetics, which I think is pretty exciting.
So I'm going to ask one more question, and then we'll open it up to the audience for 2 or 3 questions, depending on the time allotment. So if you have some questions, be ready for them. The last one I'll ask before going to the audience is just talk a little bit about the U.S. market versus the international market, what's interesting. Because I know for a lot of companies that are coming in, they're trying to figure out, do I go international first? Which markets are worth investing in? So maybe a little bit about the dynamics of those markets and how you think about that in terms of growth and where some of these markets are going.
Yeah, it's a good question. I have to think through this. Roughly half our business, just for your information, is in aesthetics, it's almost, let's call it almost a 50-50 split. The markets that are, and there are more similarities, in my view, between the U.S. markets and the international markets. Attitudes and perceptions are all evolving in the same direction. Asia Pacific for us, and namely China, is our fastest growing business. What's different about that market is it's less about beauty or achieving a natural look, and it's more about structural changes to the face. Our filler line is growing at an incredible rate in China. We have probably 1,000 people on the ground, and that is a mission critical area for us. And there's a real interest on the part of the government in one of the provinces, in Chengdu, to set up a medical tourism capital where all the innovation and all the training in aesthetics is done. And so we have a partnership with that province in China. We also have a partnership with Alibaba that is attempting to reach 400 million women who are online on Alibaba searching for skincare and beauty products. Imagine that, 400 million. There's 330 million people in the United States. Many of them are kids. And so to give you a sense of the scale on that market, obviously, not surprisingly, South America, and namely Brazil, is a great market there. It's largely about beauty. Same is true for Middle East, Africa. Europe is the largest market in terms of volume, but the appetite for aesthetics can vary from one country to the other depending on where you are. More conservative in a place like the UK, for example. But I would say overall, we focus on 12 countries, which is the EU5, I think if I get this right. And then there's 7 more. You got China, Japan, Brazil, Turkey, Russia, and Australia. I think I got to 12.
I think it was 11, but you said that's why you weren't good as an accountant, so that's okay.
Yeah.
Thanks. Well, listen, I think that wraps it up. Thank you so much for your time and for the insights there. Again, we really appreciate sort of the Allergan's leadership and the support of the innovation in the industry, and really appreciate you being here.
Great, thanks, Mark.
Thanks.